Okay, so we're back in clinic with Emily after her filler treatments. Let's have a chat with Emily and see how you felt after treatment. Can you just give me some honest feedback about, I would say, the treatment itself?
Yep.
And then also your experience in the following 1 or 2 weeks after the filler injections that we did.
Sure. So I was surprised at how much it didn't hurt when you were doing the treatment, actually.
Okay.
Which was
good.
Post the treatment, I had nothing major in terms of any reaction. I had a small amount of yellowing, a bruising, but it was not significant, and it was quite easy to cover up with a bit of foundation, kind of day 2 onwards. And I'm very pleased with the jawline. There's definitely been some lift here and more definition here. I'm really pleased with around here. I think it looks really natural. I still think there's work to be done around here to give a little bit more lift here. Really, really happy with the, I don't know the word, but the...
Above the brow?
Yes, the brow.
Above the orbits, yeah.
And the lips, I'm happy with as well.
Okay.
So just, a few lines here, but the actual lips I'm really pleased with.
Okay, amazing, thank you. So if you remember, in this case, we previously dissolved some historical filler that's built up over 10 years. We used an ultrasound, we showed where the filler was in the wrong places. We've re-injected and scanned and shown that the filler is now in the right deep compartments that we wanted it to go into. And so then this is the follow-up after quite a significant filler treatment. Let's have a look on this camera now, if you can zoom in here for me. So I can see here that we are getting closer to the final results that we're looking for. The main thing to appreciate is that we don't have any overfilling, particularly in the under eyes or the lips. I think this additional height in the upper lip is really effective at rejuvenating the lips. And I definitely see that we've improved along the jawline and started to lift with this volumizing treatment. And again, in the upper aspect of the eye, we've lowered the depth of that hollowing with a little filler injection. That's an A-frame treatment which rejuvenates around the eye. I agree with what Emily's saying in terms of priorities. I think that we still see some laxity in the skin. We still see some creases in the upper lip. And I think the objective now is to start thinking about how we can improve the skin. And for that treatment, we're going to be looking at biostimulators. Biostimulators are not the same as what we've used before, hyaluronic acid volumizing injections. A biostimulator specifically targets the skin by stimulating the fibroblasts, and we get a upregulation, we get a deposition of type 1 collagen, and in the process, we get thicker skin, we also get tighter skin. And the objective today is to try and improve the quality of the skin and also the tightness, particularly in the lower face. And I think it would be really great to show how a combination of volumizing fillers and biostimulators can get the best kind of results. So I'm going to show you a treatment plan today which combines the use of biostimulators on the top of what we've previously done with normal fillers. Sound good?
Sounds great.
All right.
Really good.
Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like. Okay, so let's get this product ready. This is the Ellansé, this is the biostimulator. And we're going to mix this with 0.2 mils of lidocaine. And the reason we do that is because the product itself doesn't contain any lidocaine. And we want to improve the level of pain for the patient, but also adding a little bit of lidocaine gives us a bit more volume to be injecting, makes it a little bit more easy to and get the product into the subdermal plane that we're trying to inject. So after a few of these pushes, you can see how we can mix our products. This is also how we would be mixing lidocaine into any product that we might want to use, or even combining different products generally. So once we've done that, we're always going to use a 22 gauge cannula when we're injecting in this way with a biostimulator. The main reason for that is we want to minimize the risk of injecting intravascularly. So I've got a 22 gauge cannula here, and really important as well is we've done a really in-depth skin decontamination, and we want to make sure that there is as much of a sterile field as possible when we're injecting with biostimulators. Taking a look at where Emily could most benefit from a biostimulator, if we look at the crepiness, you can see the skin generally here has lost some collagen, it's lost some elastic fibers, and this is a consequence of the natural aging process. It's also photo damage and various external factors that can affect the dermis of the skin. So by stimulating the fibroblasts and improving the collagen, the type 1 collagen in the skin, not only do we create tightening and contraction of the dermis, but we also increase the volume of the dermis. And in doing so, we're going to get more youthful looking and tighter skin. And so I can see that I want to create some biostimulation in this direction. And so fanning a cannula all the way up to even into the subcutaneous plane in the temple is going to allow me to achieve this. But I also want to cross over this marionette fold to try and reduce some of the tethering of the ligaments and try and create as much of a nice transition from the jawline through to the chin. So I'm going to fan in this direction, but I'm also then going to fan in this direction with a cannula. And we're using here a 22 gauge cannula, and the reason for this is that we want to minimize the risk of any intravascular complications. And the larger the cannula, the lower the risk of the cannula being sited inside a blood vessel. That's particularly important when we're using biostimulatory products, because we're not able to actually dissolve or reverse the biostimulator. And so, yes, we're injecting in a plane where we don't think there's going to be any major blood vessels, but at the same time, we want to inject in the safest possible way. And so you can see this is the depth, this is the subcutaneous plane. And if the first rule is to minimize the risk of any intravascular product, the second is to avoid nodules. And using a biostimulator has a risk of nodules because we're injecting a very active stimulator next to these fibroblasts. And so if we concentrate the product in any singular area, the patient could feel lumps under the skin. And so you'll notice when I'm injecting, I'm just creating as much even spread as possible of the biostimulators without much overlap and without concentrating the product in any single area. I'm also injecting in the direction that I want to achieve the stimulation, and that means I'm going all the way up towards the zygomatic arch and even actually sometimes into the temple as well. This little bit of resistance here is little fibrous septations within the subcutaneous plane, and it's worth understanding that we're not just stimulating the dermis of the skin here. The entire subcutaneous plane has a huge amount of collagen bundles throughout it as these little divisions throughout the subcutaneous plane that I'm moving through here all kind of create a subcutaneous network of collagen fibers and fat. And so as we stimulate the skin, we're also stimulating the subcutaneous fat tissue, and the compartments that divide those fat pads are all tightening and all contracting, and all of that contributes to the aesthetic result you see after treating with a biostimulator. How are you doing here, Emily?
I'm great, thank you.
Okay, just keep breathing. Yoga breathing.
And exactly.
Sit forwards for us, Emily. Let's get this on camera now. I just want to see this. Not that it has much particular clinical relevance, but I just want to show what it looks like before and after. So this is immediately after the biostimulator treatment, and a lot of what you see in this immediately afterwards is just the fact that I've injected volume. It's not, of course, we're not seeing here the benefit of the stimulation yet, but you can see the areas that I've targeted with the biostimulator. And what we'll do is we'll come back in a few weeks' time and we'll see how the biostimulator has taken effect, and we can take some final photos as well.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
Welcome back to our clinic at Harley Academy, and I'm really happy to have Emily back for her final checkup after quite an extensive treatment plan. So let's try and recap together the journey so far. So you joined us at the start of this about 6 months ago, I would say, and Emily was very open-minded about the treatments that we could go through. And if you don't mind me saying, you're also kind of going through some difficult life challenges, and everything was changing for you. And so we had a look, and what we saw was that there was lots of historical treatments that were done. We looked on an ultrasound scan, targeted dissolving of different previous filler in different compartments, some of them too superficial. And then Emily lost a lot of that volume, and over the last few treatments we've replaced volume in a very structured way, as you can see in the video. We've also used a biostimulator, and then since then Emily's also had some toxin and profilo, so the full works over the last 6 months. But what I'm really interested to hear is your honest feedback, because people are watching are going to be interested in the journey that you've been through. Sure. And they might be in your shoes and thinking about treatments. So yeah, please tell us.
Well, number one, it was a bit of a shock when you dissolved it all, because I'm so used to having the filler, and it had been there, I think we worked out, at least 10 years. What has been lovely is I really feel like it's kind of been a bit of a canvas that you've worked on, and you've consulted with your colleagues, and you've really thought about all the treatments that you offer or that you have available to you, like the toolkit, if you like. Mm-hmm. And you've kind of really explored what was available to give me the best possible results. I'm thrilled with, there was a very, it wasn't massive, but it was subtle with the tear troughs. Mm-hmm. I'm thrilled with the cheekbones and just in the temples. I think this is really, I'm really happy with that. I also am really happy you've definitely lifted the jawbone. Mm-hmm. So overall, I'm honestly very, very pleased. And I appreciate how you've managed me as well. I think that's part of it as well as a client, and I really appreciate that.
And we'll just do a final review of Emily. For me, Emily has a really kind of elegant face, beautiful bone structure, looking very, very natural. And a lot of the areas that we've treated now, for me, have completely settled. A lot of that biostimulation is continuing to work and creating tightness across the mid-face. You'll notice some of the more subtle areas of refinement, like the upper eye and the upper lip that's been treated. And if you give us a really big smile, you can see that she's not overfilled. She's looking very natural on expression and relax. And at rest, you see this natural flattening in the anterior mid-face, which for me isn't something that I want to additionally treat. I think this shot, you can see here very clearly, Emily's a very beautiful face. The thing that concerns her ongoing is this little shadow here, and it's tempting to try and soften this, because previously there was a lot of filler up here which was bunching it backwards, and whilst I appreciate that's possible, in this case it's just a really important learning point that it's not going to be possible to add more volume to reduce this shadow because she would look overfilled. It's also not a good shadow nasolabial fold to treat directly with filler, and so this is one of those facial aging features that is part of Emily, and it's not something that we necessarily can or want to reduce. If it was something that was of ongoing concern, then we could look at skin tightening to try and lift the shadow this way. But for me, I think Emily's looking fantastic. So thank you again for being part of that. Is there anything you want to say to people that might be watching who have or looking at going through this kind of experience? Anything you want to share?
I would say I think it's useful to do your own research in terms of the products, and obviously there's loads of information out there online, so that you're coming with some information. I think be realistic in terms of your expectations. I'm 53. I shouldn't want to look 23. So I think, coming with realistic expectations. But probably the biggest thing for me would be to trust you guys and trust that you come with, mountains of experience of treating patients and the products that you're using, and knowing what they can achieve. Perfect.
That was exactly what we try and share to our patients, and like I said, a really good journey. So thank you so much again.
Thank you.
And
thank you.
Hope you've enjoyed this video, everyone. If you want to follow up with Emily's journey or see more content like these kind of full feature, full treatment plans, then you can continue to subscribe to the channel because we're going to be publishing these every month. So thank you for your time, everyone, and we'll see you next time.